Hello, welcome back to our podcast. I am Bolorjin and my teammate is Margad. Today we are going to talk about OCD disorder. Did I shut the garage door? Better double check. Did I lock the front door? Better double check. The oven off? Better double check. Double checking things is a pretty common human behavior. But what if you feel compelled to triple check it, then it might be considered an obsession. These are the symptoms of obsessive compulsive disorder or OCD. OCD is a serious condition that causes great distress and really impacts people's lives. People become overwhelmed by their thoughts and anxiety and feel like hostage to the rituals that help take away that anxiety. One of these voices is mine. Every public surface I touched felt like full of germs. The only way I would feel better was to wash my hands. And I did it 20 times a day sometimes even more. People with OCD experience obsessions, which are specific thoughts that are intense and intrusive. People don't choose to have them, and they are often very distressing. Obsessions make it hard to concentrate or get anything done. A lot of times these thoughts are about germs or safety. The second symptom of OCD is compulsions. These are ritual behaviors, and people with OCD do them to help deal with the anxiety, horror, or distress they feel because of their obsessive thoughts. There are many types of compulsive behaviors, but they often focus on washing, cleaning, or checking on things for safety, or repeating words and numbers.
OCD effect. The compulsions and obsessions may take up many hours of a person's day and can interfere with the family and social relationships. They can also have a negative effect on the education and employment. As OCD becomes more severe, avoidance may become increasing the problem. The person may avoid anything that might trigger their obsessive fears. OCD can make it difficult for the people to perform everyday activities like eating, drinking, shopping, or reading. Some people may become housebound. OCD is often compounded by depression and other anxiety disorders, including social anxiety, panic disorders, and separation anxiety. Causes of OCD. The causes of OCD are not fully understood. There are several theories about the cause of OCD, including the compulsions or learned behaviors which become repetitive and habitual when they are associated with the relief from anxiety. OCD is due to genetic and hereditary factors. Chemical, structural, and functional abnormalities in the brain are the cause. Distorted beliefs reinforce and main symptoms associated with the OCD. It is possible that several factors interact to trigger development of OCD. Treatment for OCD. The treatment for OCD can include psychological treatments such as cognitive behavior therapy, the anxiety management techniques, support groups and education, and medications. Psychological treatments such as cognitive behavior therapy can improve symptoms, and this improvement is often maintained in the long term. Okay, now let's talk about what is the cognitive behavior therapy. The cognitive behavior therapy aims to change the patterns of thinking, beliefs, and behaviors that may trigger anxiety and obsessive compulsive symptoms. This therapy uses education to promote control over the symptoms. The education includes information that helps to expose myths about the causes of OCD. The part of therapy involves gradually exposing the person to situations that trigger their obsessions and at the same time helping them to reduce their compulsions and avoidance behavior. This process gradual and usually begins with the less fear situation. The exposure, tasks, and prevention of compulsions are repeated daily and consistently until anxiety decreases. Over time, this allows the person to rebuild trust in their capacity to manage it and function even with anxiety. This process is known as exposure and response prevention. Cognitive behavioral therapy should be undertaken with a skilled specialist, mental health professional. Overuse of the alcohol, drugs, and some medication may interfere with the success of this type of treatment. Thank you for watching our video, and don't forget to hit the like button.